My name is Dr. Adenike Eketunde, and I'm your host on Health Domain. Health is not just the absence of disease, it is a state of complete physical, social, and mental well-being. On this show, we'll be debunking myths, we'll be displaying pictures, videos, and anything that will make learning fun and easy. Today's topic is mental illness. We have our psychiatrist here. She's a special guest, and she has been working as a psychiatrist for over 2 decades. She'll be enlightening us about mental illness. Stay tuned, we'll be right back.
I am Dr. Oyekomi. I am a consultant psychiatrist. I practice psychiatry and I have been in this practice for about 2 decades. Psychiatry is a branch of medicine that caters for people with psychological problems. Psychological problems refer to people that have problems with their thoughts, their emotions, and their behavior.
Welcome back. Still on mental illness, we'll be having our special guest today. She's Mrs. Oyekomi. She'll be enlightening us about mental illness. Mrs. Oyekomi, please tell us what is mental illness.
Thank you so much. Let me start this way. That word actually scares people. Mental, that word, mental, scares a lot of people. Because when people hear it, they think that it's all about madness. But mental is a very simple word. It refers to the mind. And the mind is that part of us that enables our thinking, our perception, our emotions, our willpower, our motivation, and behavior in general. So when one is able to perform all these processes successfully, you say that person has good mental health. So any aberration in the performance of all these processes, that is, any aberration in your thought system, the way you think, any aberration in your emotions, any aberration in your behavior is referred to as mental illness. And that mental is just like cardiac. Cardiac refers to the heart. Renal refers to the kidneys. Osteo refers to the bones. So when we say mental illness, we mean mind illness. The illness that has affected the thinking, the emotion, or the behavior of a human being.
Talking about mental illness and the disability, what are the types of mental illness, the most common ones? Because there are lots.
Yes.
There are lots. Can you just brief us about the most common ones and the disabilities that they can cause?
Okay. Mental health is not the same thing as not having a mental illness. We actually say that mental illness exists on a continuum. So that means you can have from mild to moderate to severe. And then you can have different types, just like you said. So there are different types depending on the domain of mental functioning that is affected. So for example, if the emotional centers is affected, so someone can have things like anxiety, phobia, depression, and any type of emotional disturbance. If the domain of thinking is affected, the person can have something like schizophrenia. If the memory domain is affected, the person can have dementia. So we have different types and different severities and different presentations of mental illness. Now, the one that people really know as mental illness, unfortunately, is the one that they refer to as madness. People think that mental illness only refers to the madman. Let me say mad, I don't like to use that word. They think that mental illness only refers to the madman, in quotes, that is walking on the streets naked and dirty. But mental illness is much more than that. There are some types of mental illness that the person will be well-dressed and beautiful like you. I'm not saying that you have mental illness, and then the person might even still be going to work, but the person might not be productive. So mental illness is not only when you remove your dress, or you walk naked, or you are disheveled, or you are dirty, or you are talking to yourself, or you are picking things from the ground. Mental illness is much more than that. So what I'm saying is that the signs and symptoms can be subtle and alarming. So it's only the alarming ones that people see and they refer to as mental illness. For example, if somebody has depression is a mental illness, is a type of mental illness that affects the mood. Now, a depressed person may not look odd externally, but that person is suffering because that person is not happy. That person finds it hard to live through the day. That person might have lost interest in things that he or she used to enjoy. That person will become less productive. These things are like internal. They are not really outward, you know. So mental illness is much more than the madness that you see on the street. And by the way, that madness is an end result of an unattended to mental illness. It's a type. It's a very, very small fraction of the range of mental illness we have. So it's like somebody has hypertension now, and your blood pressure is maybe 160, 100, and it's consistently so, and then you don't do anything to it. It can keep on rising, and then at a time you can have stroke. So stroke is the end result of an untreated hypertension. So the same thing applies to the mad person on the street. So madness, or roaming about, or vagrancy, like we call it, is the end result or the end product of a type of mental illness that was not attended to. So it doesn't mean that when one has mental illness, the person must necessarily end on the street. There are some mental illnesses that the person can remain indoors, can be going to work, but is not functioning at maximum potential.
Talking about common mental illness like schizophrenia that people refer to as madness and depression, these are common ones. How do people see the signs? What are the red flags before you reach the stage of going to the street? What are the signs you see that will prompt you to go to the hospital, or you tell someone, I think this person needs help, what can we do? What are the signs and symptoms, and how do you go about it?
Yeah, good question. You know, every disease is a process. Most diseases will start with small symptoms. You know, they will start insidiously, and I mean, the person may not even be aware of it, but the people around, you know, may begin to notice that this person is changing. So any change in the normal pattern of that person. So, for example, you have a friend who used to be very chatty, and then gradually the person is becoming reticent, you know, doesn't want to talk, and he or she does not want to associate with other people like he or she used to do before. Or the person seems not to be interested in those things that the two of you used to do before. Or the person is not eating well, or even overeating. Because sometimes, you know, people eat a lot to medicate the distress they have. For example, you would expect a depressed patient to lose appetite. But there are some types of depression that the opposite would happen. The person would actually be overeating to medicate that pain of depression. So what I'm saying is that any change in the person's character, any change in the person's normal habits, in terms of maybe sleeping, sometimes the person would not be able to sleep well, sometimes the person would be oversleeping, which we call hypersomnia. So any change in the person's interaction with others, any change in the person's sleep, eating pattern, you know, behavior, should arouse, you know, the next person to think that, oh, maybe this person has some mental challenges and should be taken for prompt attention.
For those people that they've already reached the late stage, or let me say severe stage, like people on the street, how can people help them? Are there treatments for them? Can they get better? What are the options for them? People on the street have reached the severe stage, not just the ones that you can...
Are just starting.
Yes.
I mean, in fact, there is hope. You know, even as severe as that one already is, you know, there's still hope. You know, and what people can do is, I mean, you can bring them to the hospital. You know, that is what the government should be doing anyway. You know, we shouldn't even be seeing any mad person on the street. So back to the question that you asked. Yes, there is treatment for them. And I've seen quite a number of people that were roaming the streets that were brought to the hospitals, and when we instituted treatment, they got better and they returned back to their normal lives.
How can you prevent mental illness per se?
Good. Before we talk about the prevention per se, let's even talk about maybe the causes. Now, the precise cause or causes of mental illnesses are not known. But there are so many factors that are associated with it. And we call these factors risk factors. So risk factors are factors that will make you likely to come down with mental illness. And by the way, mental illness can happen to anybody. Nobody's immune. Yeah. Yeah, it can happen to a woman, to a man, to the poor, to the rich, to the Caucasian, to the black, any color, any race, any ethnicity. So nobody is free. No, I mean, you can't say that, oh, it cannot happen to me. It can happen as long as you have a brain, because the residence of your mind is your brain. The way we talk, the way we perceive, everything is coming from the brain. So as long as you are a human being, you can develop mental illness. So biological factors include things like genetics. Sometimes if somebody comes from a family where maybe 1 or 2 persons have mental illness, the person has a higher risk of developing mental illness when that person encounters stress in life. But that is not to say that the fact that maybe your uncle or your father had mental illness, that is not to say that you must invariably have it. It's a combination of so many factors. And these factors, can further be divided into predisposing factors, precipitating factors, and maintaining factors. So predisposing factors are factors that would increase your vulnerability, like maybe when your mom was pregnant with you, maybe your mom did not eat very well, and your brain development had been compromised. And then sometimes during the birth process, if there are obstetric accidents, and oxygen did not supply, or oxygen did not go to the brain on time, there could be some compromises in the integrity of the brain, so that such persons can now come down with mental illness later in life when the person is exposed to stress.
Welcome back. We will continue from where we stopped with Dr. Oyekanmi. So can you tell us, do they need mental evaluation for any political or any other appointment in Nigeria? Do you think they should actually make it a criteria for appointment?
Well, that question is really a very controversial question, but let me answer it this way. There are some jobs that require psychological evaluation before somebody is offered such jobs. For example, to be a security person, like maybe a policeman or maybe a teacher, a doctor, a politician, people that occupy sensitive offices. It has to be sure that you are functioning well psychologically, and they even do it in advanced countries. They do it in the US, they do it in the UK. I am very sure of the fact that before you are allowed to study some medical courses, you have to go through psychological evaluations, and then before you are admitted into the police college to become a police officer, you have to go through psychological evaluations, and then even in some political appointments, the people are taken through that evaluation to be sure that, is this person qualified? Can this person function well as somebody who is going to occupy this office? For example, a politician should be somebody who can be sympathetic, who has empathy, that is, you can put yourself in another person's shoes. So, if that person is psychologically evaluated and the person is seen to be an antisocial person, maybe a psychopath or a sociopath, that person does not have anything to do in the political office, because that person cannot feel the pains of others. He doesn't just care. So that person is not fit to be a politician. That person is not fit to be maybe a local government chairman or a governor or even a president. Somebody that cannot feel the pains of others.
Okay, so when you talk about political appointments, and there are a lot of things that is happening in Nigeria, like the snake taking our money from the JAMB office, the animal, even on the news that the monkey actually stole about 70 million naira and all. Do you think this is actually part of mental illness, or this is just generally something that just happens and it's funny and it's just a joke?
There's really nothing. I don't think that the people that said that the snake consumed the money or the monkey consumed the money, I don't think they are sick. They knew what they were doing. They are just criminals. That's it. So I would say that the person that said that the snake consumed the money, and is not showing any other sign of mental illness, the person is a criminal.
Thank you so much, Dr. Oyekomi. Stay tuned. We'll be right back so that she can tell us more about mental illness. Okay, thank you so much. We'll be talking about myths of mental illness now. So one of the myths of mental illness is that it's not real. It is caused by supernatural powers, and you can actually cure it through supernatural ways like going to the herbalist and all.
Yeah, that's a very common misconception. That's a very common myth. You're very, very correct. And then this misconception is further so much allowed to be entrenched in this part of the world, especially in Africa, by the media. And I'm glad that you are doing something like this to educate the people and let people have the right knowledge and information about mental illness. Nigerian home videos, they are not helping in this matter at all. They are always depicting mental illness as a retributive illness. That is, that mental illness is a punishment for a wrongdoing. So the way they do it is that maybe there is a witch in the village, and then the witch does not like your progress. And then the witch now afflicts that person with mental illness. And then they will now say that the only cure is to go to carry that person to another herbalist who is going to recite some incantations, and then that spirit would leave. That is a gross misrepresentation of mental illness. And this has deranged a lot of people. We attribute so many things to spirituality. So that myth is too rampant. So that's why a lot of people, when they start to show signs of mental challenges, there are people who first take them to the spiritual homes, maybe to the herbalists, maybe to the pastors. So there's really nothing spiritual about mental illness. It's like any other illness. So mental illness is a bona fide medical illness. Where the problem is coming from is the brain. And the brain is an organ of the body, just like the heart, the kidneys, the liver, the lungs, and anything could happen to any organ.
And this brings us to another myth that says that children don't usually have mental illness.
That's another myth. That's another misconception. I mean, children have brains, although their brains are still developing. So a child who cannot learn very well in school, a child who cannot communicate, a child who cannot, who has some aberration in social interaction, a child who will just stand by himself and will not play with other children, that child has mental challenges. So a child, anybody can have mental illness. There's really nothing, nothing esoteric about mental illness like people think. It's a medical illness. It's a biological illness that is emanating from the brain.
Okay, coming to that, that means people would like to know if autism and also Down syndrome can be classified as a mental illness.
Yeah, autism is a mental illness. Though some people prefer to use other terms, because people don't understand that word mental. So there's so much stigma surrounding that word mental. And like I explained earlier, mental simply refers to the mind. So some people would like to say maybe autism is a psychological illness, autism is a behavioral illness, whatsoever you say. Psychology, behavior, everything is mental. So, people like to use what I call euphemistic terms, It's like calling a prostitute a scarlet woman because you don't want to call her a prostitute. You say a scarlet woman is still a prostitute. So if you say psychological disorder, it's the same thing as mental disorder. So autism is a medical condition. It is a mental condition. It is a mental disorder. Because autism is associated with an aberration of communication, social interaction, and behavior. That's it. Then Down syndrome is it's a genetic disorder that affects the chromosomes, Now, some children with Down syndrome can also have what we call comorbidities. So sometimes, because of that chromosomal aberration, it can affect their brain development too. So they also can show signs of mental challenges. So Down syndrome per se is not a mental illness, because it's a chromosomal illness that can now manifest as mental illness.
So what is the difference between autism and Down syndrome?
Autism is straightforward mental illness because autism affects the communication, the behavior, social interaction of a child, whereas Down syndrome is better classified as a genetic disorder. Now, people say that, autism can be genetic. Yes, it's sometimes, we know that if a sibling has autism, there is a higher risk of subsequent siblings, to have autism. But it's really, really not clear-cut. We can't say that, it's definitely a genetic disorder. Like I said, the causes of many mental illnesses are not known. But it's a combination of so many things. But that of Down syndrome is very, very clear. It is a genetic disorder called trisomy 21. That one is clearly a genetic disorder, but can also have some affectations of the brain, which can also manifest as mental challenges.
Okay, does mental illness have a definite cure? Because some believe that if you have a mental illness, even if you're taking drugs or you're doing psychotherapy, there's still risk that you're going to develop the symptoms.
It's going to keep on coming. Now, there are different types of mental illnesses, just like there are different types of physical illnesses. There are different severities too. So depending on the type and the severity, so these are the things that would dictate the type of treatment. Basically, we have two major types of treatment for psychiatric or mental illnesses. We have what we call the pharmacotherapy part, that is taking drugs in form of maybe tablets of injection. And then we have what we call psychotherapy, that is talking to the the person that has mental illness. So for example, if somebody has mild depression now, the person may not even need to take drug. Psychotherapy alone might help. And then that is for somebody who has mild depression. But when you start talking about moderate depression, severe depression, or you start talking about schizophrenia or depression with psychosis, this persons would need a combination of the two. So most of what we use in the treatment of mental illnesses, it's a combination of the two major types of treatment. It's a combination of pharmaco and psychotherapy. And they are very, very treatable, although the person may need to be on medication for a very long time, just like hypertension. If somebody is hypertensive, you have to be on medication for a long time, even most of the time for a lifetime. So what's the big deal? As long as the medication is working and you're able to function well, so there's no big deal about it. So what I'm trying to say is that the fact that somebody has any type of mental illness does not mean that that person cannot get well again. It does not mean that that person cannot function as a human being again. It does not mean that that person cannot achieve the maximum potential that person has within him or herself. So it all depends on getting the right treatment at the right time.
You've been debunking the myth that only mad people or mentally unstable people can cure mentally unstable people.
That's not correct. So are you saying that as a psychiatrist, I'm probably not mentally stable? That's not correct. It's just like saying that only pregnant persons can take care of pregnant women. So that is to say that only pregnant people can deliver pregnant women. For example, so you're saying that a pregnant woman must only be attended to by a pregnant doctor. Meanwhile, most obstetricians and gynecologists are males.
That's right to me, because people
it's
actually
not correct.
Believe that most psychologists
and psychiatrists are not okay.
Yeah, that's actually true. They believe
no, that's
when
not
they
correct.
behave sometimes because they've seen a lot of
no.
ill patients. Behave fine.
No, mental illness is not contagious. It's not something that you're going to get because you are interacting with somebody that is mentally ill. No, it's not. That's a complete fallacy.
Okay, I also want to know if you can actually cure mental illness with spiritual methods.
Mental illness is a medical condition. Can you cure hypertension with spiritual methods? If the answer is no, then that of mental illness is also no. Although we know that there is a place for God in everything. That is why the medical logo says, we care, God heals. So we know that the ultimate healing power lies with God. But that is not to say that once somebody has mental illness, take the person to church. No. Your pastor can be praying for you. Your imam can be praying for you. But take orthodox treatment. There are fantastic drugs that once you start taking these drugs, you're going to live a normal life. Just like you would live a normal life if you have hypertension or diabetes. That's...
Okay, thank you so much, Dr. Oyekomi. And she has said basically everything. Having a mental illness is not the end of the world. You can live a normal life. You can get people off the street by doing the normal thing, going to the doctor, taking your therapy, either psychotherapy or pharmacotherapy. You can live a normal life. And we hope that this information gets to a lot of people so that we can create more awareness that mental illness is not as bad as it seems. Thank you so much. Until next time, stay with us. Health Domain.